So I want to talk about, I want to reinforce a lot of what Amanda said because what she discussed in her speech really mirrors a lot of what I was thinking about today. And I think there was actually a couple things you said that I had exactly the same phrase that I wanted to state. So I want to try to do this quickly. What I really want to offer you today is a solution. And I think that there is a solution to what we're trying to address here. I know this is an emerging, kind of evolving issue that we're all involved in, but it really sounds a lot like community development. And I want to kind of just lay out a couple concepts and a couple strategies that we employ in the community development field. Do we have any community development practitioners here in the room? Raise your hand real quick. Well, you can all raise your hand because you're all community development practitioners because you're here today. And I want to just throw out what we're calling in our field, and I'm speaking for kind of the state of Massachusetts right now in the community development field, what we call a theory of change. And we really are looking at a three-legged stool, conceptually. This is going to line up with what you heard earlier. We're talking about advancing the health equity mission, and we are looking at building communities, one leg of the stool. And what falls in that category is building human capital through the community engagement that we heard about earlier, and the community development practitioners playing the role of facilitator in the community, creating the space, some people refer to it as the third place, creating the space for discussions to happen in the community and building trusting relationships within that process. That's the community engagement piece, briefly. Second leg of the stool, improving places. This is where we talk about the physical improvements of our communities. Physical environment, we talk about economic development, opportunities for jobs and resources. Community planning, working together to have a vision for our community, and accessing local government and other institutions that have influence and decision-making ability. And land use, how we use land and how we conceptually think about how we're going to use land. Thirdly, third leg of the stool, which I think is kind of a culmination of the other two, is transforming the lives of the people in our community, transforming our communities. And we do that through other strategies we heard earlier, asset development, helping people understand how to use and manage money and be educated around that, social service delivery and support, and finally, advocacy. These are the ingredients, I think, that can help us build a more equitable community. Community development really is a systems-level approach to problem solving in the community. Our focus is to build sustainable communities, so this ties back to the idea of a grant lasting 1 year does not help you get a sustainable outcome. We need longitudinal work to be done, and we need our programs and our work that we do to be funded more securely going forward so that we can have long-term goals and long-term planning. We also identify we need to be able to identify needs that are current, and the reason we need the longer-term approach is we need to identify needs that are anticipated in the future. A couple last comments, and then I'll pass it on. Language is important. I think we heard some terms today that are helpful, and it's important for us to work that out because it really symbolizes what we do and attaches meaning to the things that we do. So some of the terminology we heard today I think is really important for us to be thinking about. So what is the solution? Really quick, here's the solution, folks. There's a new law in Massachusetts called the Community Investment Tax Credit. There are health impact assessments being done in the state right now on this new program. What is this program? It allows local people, businesses, and institutions to invest in community development corporations and receive a tax credit on their social investment. This is going to build social capital in our communities, and it's going to allow us to expand the work that we do and bring in new partners. So for those of you who are here who are funders, there are CDCs out there you can partner with. My CDC is the Hilltown CDC. I'll try to talk to you later more about that if you want more information. I want funders to rethink their strategies, as was stated before, and I want policymakers to rethink how they can incentivize collaboration and the integration of systems to break down those silos. As Amanda said, we have to create the conditions in our community in order to move forward with this agenda, and the place, the other quote I wrote down was, the place does really matter. So each of our communities are going to have slightly different strategies, but we need to speak as one voice in our larger community in order to accomplish these things. That's my setup. I'm happy to answer other questions as we go forward. Thank you.
Great, great. And we're going to have Pastor Radolph.